What's up, friends? So I want to talk about something that affects literally everyone who wants to work on their abs. Everybody that I know that has had hip pain generally comes to a conclusion that they have either a hip impingement or a hip flexor strain. So this is really important for anyone that wants to get a six-pack, anyone with low back pain, anyone with hip pain, constantly sore quads, just if you are working core a lot, especially if you're kind of running this core program with me. So hip flexor strains. Is it a hip flexor strain? Is it a hip impingement? Is it just soreness? Let's figure out what it is. For most people, the hip flexor is a pretty weak muscle and we tend to overload it. So you will need a mini band for this one, and sliders or paper plates if you have them, or just socks on a hardwood floor or something. So hip flexor strain, how do you know if you have a hip flexor strain? Well, number one, you should know some of the causes. If you have a hip flexor strain, that could be coming from osteoarthritis. It could be coming from bursitis in any of the hip joints or any of the areas around the hip. So we're talking about just like the iliopsoas, like I always get it wrong, or the psoas muscles. People tend to have pretty tight outer hips. So if we're looking here, if we're looking at the spine, this is your belly button here. Psoas major, psoas minor. This is going to be a pretty tight area where we stretch and reach over. People have a lot of tightness there, and the hip flexors, a lot of tightness in the inside of the hips, even sometimes coming down into the quads. I hear this a lot of the times when someone's doing, for example, a leg raise. So they're down here, raising their legs up or heels to heaven, kicking legs up to the sky. As you're coming down, you're like, oh, my hip flexors. That tends to be the biggest limiting factor in core training. So here's everything that's included in it. I wanted to just show you a little diagram so you can kind of look at the body in terms of anatomy and where we are. So piriformis, that's another thing. People always like saying, oh, like I have this really big tightness like into my low back. It could be piriformis sciatica maybe, or pseudo sciatica. And then also our adductors. So adductors, whenever we're doing, say, a bridge abduction, we're kicking out, pushing out, or you're on one of those machines, driving out, or even driving in, those are engaging outer and inner hip muscles. So all these things are affected by each other. And it's not just core work. That's what everyone's like, oh, I'm not worried about it. I don't do a ton of core work, or I just do crunches. Well, your hip flexors play a huge role, because the hip flexor group, it's a lot more than just this inner part of your hip, you know what I mean? We're talking about upper. We're not just talking about right here. We're talking about up, connecting into the low back. A lot of people who have low back pain tend to have weak hip flexors. If you play a sport with a lot of rotation, dance, ice hockey, inline hockey, in figure skating, anything where you're rotating, football, lacrosse, how many times do you see people turning? Even in baseball, that toss, people are like, oh, pain in my hip or low back. So this is super important. How do you know if you have a hip flexor strain? Is it cramping? Spasms, muscle spasms, trouble getting up, trouble with flexion. So flexion can look like on the floor, bring your knee into your chest. It could also be standing, bring your knee into your chest. When you get up from a seated position, do you have pain? Do you have to use your arms or kind of roll to get up? Or from a chair, do you have pain when you get up, getting out of bed? I actually have a hip flexor strain currently, and I am working through that right now. And I want to show you some of the things that I do for it every day to strengthen it. And let's talk about some of the mistakes that people make when it comes to a hip flexor strain. First of all, I always advise seeing a professional. Go to the doctor, go to a physical therapist, and they will assess if you actually have a hip flexor strain or if it's something else. So obviously, like sharp pain, sudden spasms, a traumatic event, you fall and lean forward and you feel this incredible sharp pain, or I've injured mine just doing a ton of core work, overworking. The main thing to do at first would be rest, and then you can always go for ice heat compression. And always, guys, please consult a professional on this. Please consult your doctor. But one of the main exercises I've been doing to actually strengthen my hip flexors as they've been repairing is this banded bicycle, essentially. So you can do this a few different ways. There's a few different modifications for this, but the one that I've been doing right now recently, when I was feeling really weak, was keeping my knees bent and just extending, but not fully extending because I felt too much pain that way. So this is gonna be your level. I'm gonna call this level 0. This is when you're in a lot of pain. You keep a pretty good distance between your feet. My feet are hip width apart. I've got my low back on the floor. You can feel free to support the low back with the hands and even bring your neck down straight and flat. But you're here and we're just extending, not fully. But if you can, fully extend. When you fully extend, you're gonna feel those hip flexors actually engaging and firing and working. So this one is great. Raise it up. Another one would be bridges. Top of your bridge. When I'm here, I'm feeling a really good stretch in my hip flexor. I'm squeezing my glutes tight. And this is actually teaching those muscles to work together. That's teaching the glutes and the low back, the spinal erectors, and the hip flexors, and even those quads to work together. So if you focus on kind of jamming your toes into the ground, squeeze your glutes hard to the bottom if you can. Big tight squeeze, core tight, raise it up. Bridges, a great exercise. And then finally you can do an elevated bridge. So I'm gonna face this way. I've got my bench, you can use a chair, you can use anything. Elevating up in those bridges as well will give you an additional stretch in those hip flexors. And one that's actually very interesting to do is to combine the bicycle with the bridge. So what you're doing is you're going to extend those legs straight. Now this is going to be a huge stretch in those hip flexors, and you bring one knee back. So you're bringing it into that state of hip flexion where generally pain occurs. And I wouldn't advise doing this one until you've gone through probably several days and several sets. I like to do 3 to 4 sets of 15 per leg with a nice break in between. Several days before you start coming up in that elevated bridge. Another one, our very functional movement, is going to be the lunge. So when you're doing the lunge, the key to a good hip flexor engagement in your lunge is this one point that I actually learned from this guy, Andrew, from Spread Wealth, his company. What you're gonna do is, when you come up from that lunge, pretend like you are pulling your heel, your front heel, and your back quad together, like a magnet is pulling them together. Of course, you're not actually gonna let them slide together. Start this in the bottom of your lunge position. So you're here, squeeze. So what I'm doing consciously is pulling my heel back, pushing the ground, but I'm trying to pull back. So I've got this tightness coming back, and I can feel that hip flexor really engaged. So I'm here in that lunge position. You can always hold on to something if you need it. Squeeze, and I'm pushing forward, and I have this, it's almost cramping in that lunge. And then as we get better with this one, it's a very functional movement. We take a step. When you're going upstairs, you're gonna be in a very similar lunge position, right? Especially for my athletes too, you're frequently in a low position, right? Raising yourself up into that lunge. So we're gonna come down. At the top, I'm still squeezing. Ooh, it's already starting to cramp up. And cramping is good. That's a sign that I am training a weak muscle. And I always do both sides. Even if it's only one side, like I strain my left side, I still always work the right as well, because you want to be symmetrical. It's not like you just do one bicep curl all day, right? Squeeze, pull together, and as we get more advanced, we start coming up into those lunges. Lunges. All right? I like to do maybe 8 to 10 reps. It depends on when you start cramping. If you're like 3 in, you're like, whoa, it's too much. Do your 3. Take a minute, come back to it. This is something that you could probably do twice a day, or once a day, 4 to 5 days a week. You can do this. I mean, it requires no equipment. You could do this in the morning after your kind of morning routine. I do recommend getting a little bit warm. I just did a whole workout before this, so, doing some squats, kind of assessing where you are. So if you're in the bottom of your squat and you're like, whoa, a lot of hip flexor pain, whoa, super tight, or whoa, ton of low back pain, and you have a hip flexor strain, odds are it's coming from your hip flexor. That low back is hurting because that psoas muscle connects into that low back. It's from your hip. It connects along that spine in your low back. So that psoas, when you stretch, that muscle you feel right here, that's connected right in those hip flexors. Can you overstretch? The answer is yes, you can totally overstretch. But let's talk about hip flexion as well. This is typically where the pain comes from, because hip flexion, its main function is to flex the hip. So bringing that knee into the chest. This is something that Bob and Brad, if you guys are familiar with them, they are 2 physical therapists on YouTube that are really fantastic. They do this for 90 seconds per side. And this is something that really helped me to get out of pain, is this knee to chest stretch. Keeping the other leg straight, big extension for 90 seconds per side. Obviously, you don't have to do it for that long every single time, but I think that if you want a stretch and you're feeling in pain, like sometimes when I was waking up with severe pain, I couldn't even sit up, this is what I would do in 90 seconds per side. Testing hip flexion when you are on the ground, and then also when you're standing, super important because this is a little bit more functional when you're going to stand up on something, going upstairs, hip flexion. So bring it as high as you can. You can even passively bring it up. And a good goal would be to really get your active and passive to be very similar. So if I can get my knee all the way up to, let's just say, passively to my chest, and then when I let it go, it drops significantly, that's a sign of weakness. So you gotta start working on that passive. Hold it, try to keep it up, switch to that other side. It's a really good strengthening exercise that is also a bit of a stretch. Stretch and strengthen tend to be one and the same when it comes to this specific movement. But hip flexors, super important, because if your hip flexors are weak and you're overloading them every time you do core work, it's gonna limit your core work. It's gonna eliminate a lot of exercises for you, such as dragonflies, heels to heavens, leg raises, reverse crunches, seated in and outs, all the things where you are lifting your legs, so lower abs are pretty much out of the equation when you are dealing with a hip flexor strain. So make sure we're taking care of it. Resistance band. And finally, another advanced exercise would be a slider climber. And you'll see this, that hip flexor, that hip flexion where we're bringing knee to the chest, it exists every single time you do a mountain climber. You bring your knee in. So on sliders or wheels, you're over those slider climbers, socks on a slidey surface, is a great exercise to get yourself in a state of hip flexion, hip flexion, hip flexion. Any HIIT workout, any cardio workout, any boot camp style workout has mountain climbers and planks and plank jacks, and you don't want to be limited by your hips. So those are some strengthening exercises, some stretches I would recommend. I showed them in the one foundation video, but whenever you're going for a stretch, a lot of people will just go like this and just shove forward. They have all this pain. They're like, oh, it's stretching because it's tight. No, that muscle's crying, girl. Let's bring it to a point where you're in that lunge and you're gonna just lean forward slightly and see that arch in my back. I'm gonna go from that anterior tilt to posterior tilt. Lean it back, lean it slightly forward, and you're gonna feel a really good stretch. Instead of it burning when you're here, I feel this almost like burning down into my hip, into my adductors, and out here. And instead, when you're in that lunge position, arch, posterior tilt, and lean, I'm feeling it straight down, and it feels like a decent, gentler stretch that I can hold for longer. Always make sure you can breathe in those positions. Again here, anterior tilt, you're gonna tuck those ribs down as you posterior tilt. You don't wanna be up here. Posterior tilt, lean forward slightly, make sure those hips are still pointed forward and not turned out. And that is a little bit more gentle of a hip flexor stretch, as well as other ones. If you're gonna be if you're comfortable enough to be in that runner's lunge position, this is the world's greatest stretch. Bring it here. You got that stretch here and in that quad as you're flexing that quad. Relax, flex, relax, flex. Even adding that little rotation might be a little bit of relief into any kind of low back pain you're feeling because of a hip flexor strain. So as always, guys, take all of the advice you see on the internet with a grain of salt. This is my experience. This is what I've learned as a trainer. This is what I've learned through research and through my own hip flexor strains. This is probably my second one ever. But remember, talk to a doctor, see a physical therapist. Somebody seeing you in person can tell you immediately what to do and what is wrong. I think that all these exercises are pretty gentle, pretty safe, and we can all kind of strengthen our hip flexors a little bit more. So these banded exercises, mountain climbers on sliders, are all pretty safe as long as you feel good in them. If you have chronic knee pain, obviously, or just tore your ACL, being in a playing position is not probably comfortable because you're putting a lot of that pressure. If you have really tight quads, don't be afraid to roll out your quads, guys. These are all connected. Our leg muscles are very connected into our back. Our whole body is connected. So if you are having hip flexor pain, don't be afraid to get that roller in there on those adductors, not on your hip flexor, on your adductors, inner thighs, and on your quads, on your hamstrings. If one thing is tight, another thing's gonna be tight. And if your hamstrings are tight, typically, because of low back pain, they're protecting the low back. They're trying to protect the low back by tightening, right? If your quads are tight, maybe because they're trying to protect the weaker hip flexors. So roll things out, gentle stretching. That's why athletes in yoga and Pilates have pretty strong hip flexors, because they're always in a state of extension. They're always in a state of hip flexion. They're always working in those states and holding those positions for a long time. So end range of motion, think about a split. That's your end range for your hips. They can't go anymore. And for a lot of people, for their hamstrings. So that position holding is an isometric strength exercise. So am I saying everyone needs to be able to do a split? No, but working toward exercises that progress in a split will make your hips stronger, will make your hamstrings stronger, because it bulletproofs them in those stretch positions. So if you happen to ever fall and slide out on your leg, you don't pull your hamstring, you don't pull your groin, because they're used to being in that position. So definitely yoga, Pilates have their place in routines. If you are any kind of combat athlete, or you are a college athlete playing football, lacrosse, soccer, basketball, if you're someone who just likes fitness, someone who wants to work on their core strength, don't ignore those other kind of like slower pace workouts such as Pilates or yoga, because they have a huge place. I try to do yoga and Pilates exercises within all my routines. I try to do yoga at least once a week. I should be doing it twice, but we'll get there. So take care of your bodies, guys. Take care of those hip flexors. It will make a huge difference in your core performance. And I'll see you guys next time for the next video. I'm going to be doing a little isometric work with a beginner, intermediate, and advanced version in the video. All right, guys. See you next time. Oh, also, I did forget to mention two stretches that I do think are beneficial for the hip flexors. One would be the butterfly stretch. And something I see a lot of athletes do as they get more advanced is actually putting weights. It sounds ridiculous if you're in a lot of pain right now, putting weights on their knees to push them down even further. I know some dancers and definitely more flexible athletes that can bring their knees to the floor. I cannot. But the butterfly stretch, as well as your pigeon stretch, that pigeon pose, keeping that position and even folding into it, is a great stretch. Also for that piriformis, for the outside of that hip, and even doing these light, a little bit more gentle psoas stretches into the side, no longer than 30 seconds per side. And remember, guys, don't stretch before you work out. A stretched out muscle is a muscle that is most likely to be injured. So never stretch out before you're doing training. It's like if you sat there and just stretched your biceps and went to do curls, when you're contracting the muscle, you're more likely to have injury. Same thing goes for the hamstrings, especially hamstrings, and quads and calves and all those things. So unless you have really, really tight calves, I do. So I stretch out my calves several times a day, just not directly before a workout. So those stretches are great. Don't forget about them. Don't do them too often. I see people that are, sitting in a pigeon for 6 minutes. I'm like, get up. No more than probably 2 to 3 minutes. And working on flexibility is amazing. Flexibility, mobility, especially in those end range positions, super great. So butterfly, pigeon, even those light kind of reaches, as long as you don't have incredible pain and tightness, are good. And I will also mention that when you have a hip flexor strain, you could have some lower abdominal pain. It's even tender to the touch. That's where mine is at currently. I did some treatment for it, and the treatment was so painful, but it's definitely very sensitive. So be aware of your body, listen to your body, and always talk to your professional about these things, and never work through pain. You're never gonna just work through the pain. There's a difference between soreness and feeling like you're dying doing crunches because your core is burning, and pain. So that's all I got for you guys. See you next time.